31,000 years ago, in a cave on the island of Borneo, someone cut off a child's leg. No metal tools, no antibiotics, no anesthesia, no hospital, and the child lived. Not for a few days, not out of luck. They lived for 6 to 9 more years after the surgery. Until this discovery, scientists thought this kind of operation was impossible for people this early in human history. We're talking hunter-gatherers, tens of thousands of years before farming, before permanent villages, before anything we'd recognize as medicine. And somehow, someone in that world understood enough about the human body to save a child's life by removing part of it. Today we're going to look at exactly what they found in that cave, why it broke the previous record by 24,000 years, and the question that still doesn't have an answer: how did anyone survive this? The cave is called Liang Tibo in East Kalimantan, on the Indonesian side of Borneo. Archaeologists already knew the cave was important. Its upper walls are covered in some of the oldest rock art ever found, paintings of animals and hands stretching back tens of thousands of years. But it's the lower chamber where this discovery happened. A team of Indonesian and Australian researchers were digging through sediment when they found a mostly intact human skeleton. Mostly intact, except for one thing. The left foot and most of the lower leg were completely missing. At first, that's not unusual. Bones go missing from old skeletons all the time, washed away, scavenged, broken down over tens of thousands of years. The obvious explanation was an animal attack, or some kind of accident. But when the researchers looked closely at the bone that remained, that explanation didn't hold up. An animal attack leaves torn, jagged bone. A traumatic injury looks messy, uneven, exactly what you'd expect from violence or a fall. This wasn't that. The remaining leg bone had a clean, slanted cut, and around that cut, there was something even more telling: new bone growth. The kind of growth that only happens when a wound has time to heal. That single detail changes the entire story. A clean cut plus healed bone doesn't describe an accident. It describes a surgery and a recovery. Researchers used 2 independent dating methods: radiocarbon dating on the surrounding sediment and a technique called electron spin resonance on one of the skeleton's molars, and both pointed to the same age, 31,000 years old. To put that in perspective, the previous oldest confirmed amputation in the world came from a skeleton in France, roughly 7,000 years old. A Stone Age farmer whose arm had been surgically removed. This find in Borneo is more than 4 times older than that. It doesn't just add to the timeline, it rewrites it. Here's why that timeline mattered so much to researchers in the first place. For years, the working theory was that complex surgery like amputation only became possible after humans settled down, after agriculture, permanent villages, and the kind of accumulated knowledge that comes with staying in one place for generations. Hunter-gatherer societies, constantly moving, weren't supposed to have the tools or knowledge for something this advanced. But performing an amputation like this one requires detailed anatomical knowledge. You have to know exactly where the blood vessels are to avoid the person bleeding out. You have to understand the nerves, the muscles, how they connect. Get any of that wrong, and the patient doesn't survive the surgery, let alone 6 more years afterward. Someone in that hunter-gatherer community in Borneo, 31,000 years ago, had that knowledge. Not in theory, in practice, on a living child, successfully. Surviving the surgery itself is only half the story. The other half might be even more impressive. Borneo is a tropical rainforest, hot, humid, full of bacteria. Even today, with modern medicine sitting right next to it, open wounds in that environment get infected fast. One of the researchers on this study put it simply. She said she once cut her finger during the excavation and had to rush to get antibiotics in an actual hospital in the modern world. Now imagine an open amputation wound in that same climate 31,000 years ago, with none of that. For that child to survive, someone had to clean the wound, repeatedly. Someone had to change dressings, watch for infection, manage pain, keep the child fed and cared for during a recovery that took months, maybe longer. This wasn't a single moment of surgical skill. It was sustained, intensive nursing care from people who had absolutely no reason we know of to think it would work. Here's where it gets frustrating, in the best way. We don't know why the amputation happened. Was it disease? An untreatable injury? Researchers can't say for certain. We don't know exactly how they did it. What did they use to cut through bone this cleanly? What did they use to prevent infection, in a place where infection should have been almost guaranteed? And we don't know if this was one incredible, isolated case, a single genius healer in one community, or if this level of medical skill was actually common in this region, and we've simply never found more evidence of it. The researchers themselves admit they can't rule out either possibility, which means somewhere out there, buried in that same rainforest, there could be more stories exactly like this one, still waiting to be found. It's easy to picture hunter-gatherer societies as purely survival-focused. Every person for themselves, no time or resources to spend on someone who can't contribute. This discovery pushes hard against that picture. Someone in that community decided a child's life was worth the risk of an incredibly difficult surgery. And then that community spent months, maybe years, keeping that child alive afterward, with nothing to gain from it except that the child lived. That's not just medical skill, that's care. Deliberate, sustained, at a cost, tens of thousands of years before anything we'd call a hospital existed. The skeleton doesn't just tell us what prehistoric people could do to a human body. It tells us what they were willing to do for one. Before this discovery, we thought this kind of medicine started around 10,000 years ago, when humans began farming. That number is gone now. The real number is at least 31,000, and there's no guarantee that's even the true beginning. Every time we assume we know the limit of what ancient humans were capable of, a discovery like this one shows up and moves the line further back. If you want to see what else that line has moved on recently, there's more waiting in the rest of this channel.